We're going to go to item, hold on, got a member here. Okay, we're at item number 5, AB 248, Health Insurance Minimum Value Large Group Market Policies. Please proceed.
Thank you, Mr. Chair and members. Assembly Bill 248 closes a loophole left in the federal law where insurers can sell substandard coverage to large employers. I want to accept committee amendments listed in the analysis and thank committee staff for their hard work. These amendments reflect ongoing conversations with stakeholders, the department, and our sponsor. Due to the loophole that exists in current law, people cannot get tax credits through Covered California if they are enrolled in employer-based health coverage, regardless of the value of their employer coverage. Given the federal employer contribution and potential penalties, some employers and insurers may be tempted to pass off limited benefit coverage as meeting the individual mandate. AB 248 prohibits an insurer from selling a limited benefit health plan to large employer. A large employer can still provide coverage like dental or vision separately. AB 248 protects workers from being offered an on-the-job coverage below the minimum value standards. These skinny plans usually do not cover doctor's visits, hospital x-rays, hospital stays, emergency rooms, prescription drugs, hospice, or other basic health care needs. This bill will help protect Californians from finding themselves with huge medical bills that could lead to large debt when they get sick. A single emergency room visit can cost thousands of dollars. This bill is sponsored by Health Access California and is supported by the California Pan-Ethnic Network, the Western Center on Law and Poverty, and the California Labor Federation, and others. With me here today to speak in support of Assembly Bill 248 is Beth Capel on behalf of Health Access California and Ms. Sarah Flox on behalf of the California Labor Federation.
Mr. Chair and members, Beth Capel on behalf of Health Access California. This bill sets a standard for large employers that is similar to the standard that already exists for small businesses. That is, the coverage sold to them must provide at least 60% minimum value. This is a floor, which means that there could be co-pays, co-insurance, other cost sharing of more than $6,000. That's pretty bare bones coverage by most of our standards. But already in the market, we have some coverage being sold that covers prevention-only benefits. Freedom Care covers diabetes counseling, but not insulin or doctor visits. It covers cancer screening, but not chemotherapy, radiation, or surgery, or any other kind of medical care. So there are already very limited benefits being sold in the market, often marketed in Spanish to low-wage workers. You will hear from the opposition today that they want the opportunity to offer sub-minimum coverage combined with health reimbursement accounts, which are tax devices held by the employer and not particularly appropriate for the kind of low-wage workers to which this is often offered. We have met frequently with the opposition and tried to find a way to address their concerns without allowing insurers to offer sub-minimum coverage. You will see that we have several. No California insurer that you would recognize offers sub-minimum coverage, none that contract with Covered California, none of the major carriers that you're familiar with. So we are pleased to sponsor this measure to create a floor in California. Thank you.
Thank you. Anyone else in support?
Mr. Chair, members, Sarah Flox from the California Labor Federation. And I want to just start by saying the majority of employers, large employers in California, already offer coverage that is well beyond a minimum value. It exceeds it and is good comprehensive coverage. But there's a very, very small number of employers, mainly low-wage employers, who want to exploit a loophole in state and federal law that allows them to sell substandard coverage or offer substandard coverage, these skinny plans, to their workers. And an example of this is an employer who would offer a plan that is a skinny plan, substandard to workers. If the worker refuses that coverage, they can go and get better subsidized care in Covered California, and the employer only has to pay the lesser of 2 employer responsibility penalties. In another case scenario, the worker sees the low premium and says, oh, employer-sponsored coverage. They'll take the substandard coverage. In that case, the employer is off the hook and pays no penalty. The worker is barred from getting much better subsidized coverage in Covered California, and in the case that they have either an accident, an injury, or an illness, they'll be on the hook to pay for hundreds of thousands of dollars in medical bills that they probably never expected because they had employer-sponsored coverage, minimum essential coverage. So that will leave a low-wage worker with facing medical debt and medical bankruptcy, which the ACA was supposed to eliminate. So all we are asking is that this loophole be closed so that employees of large employers have the same protections that individuals and small business workers at small businesses do. Thank you.
Thank you. Anyone else?
Good afternoon, Chair, members. Luis Sanchez, on behalf of Blue Shield of California, in strong support. We'd like to thank the author for bringing this important measure forward and urge your support.
Mr. Chair, Seth Brumble here on behalf of 300,000 members of the California Teachers Association. Assembly Bill 248 promotes affordable care, quality care for all, and certainly that's important to our members, it's important to the families we serve, and important to all those who live in the state. We urge your aye vote.
Mr. Chair and members, Michelle Cabrera on behalf of SEIU California and our 700,000 members statewide, we urge your support to close this exploitative loophole and protect our low-wage workers. Thank you.
Jasmine Gordon with the California Black Health Network in support.
Amanda Wilbur, Health Policy Analyst, California Rural Indian Health Board, in support.
Elizabeth Landsberg with the Western Center on Law and Poverty, in support.
Dolores Duran Flores with the California School Employees Association in support.
Libby Sanchez, Laborers Local 777 and 792 in support.
Kimberly Chen. Kimberly Chen on behalf of the California Pan-Ethnic Health Network in support.
Manny Hicks, Californians Disability Rights in strong support, along California Alliance for Retired Americans.
Mr. Chair, members, Brian Allison on behalf of the American Federation of State, County, and Municipal Employees, also in strong support.
Thank you. Opposition?
Julianne Broyles here on behalf of the California Association of Health Underwriters, here to talk about AB 248. First of all, we do want to say thank you to the author and to the sponsors that they have been very generous with time in discussing this, and to your staff that has been taking the time to try to understand our opposition to this bill. When the ACA was passed, it had a very special carve-out for large employers. It gave and still provides to all other large employers in the country the ability to negotiate and create their health plans going through the minimum value calculation. That was done because the estimation was of the negotiators at that time is that large employers have a sophistication that they're able to negotiate their large group plans. What AB 248 does is say that we have to start at a bronze value plan, and there can be no other starting point other than that. But the federal law gives us the ability as large employers and agents who sell to large employers, the ability to do building blocks. We can take, and there are available off-the-shelf plans where we can take, and what is a frequent carve-out is a pharmacy benefit plan. That benefit plan might be a 55%. Once you add the pharmacy benefit, it might get you to 65, and they add a health reimbursement account on top of that, might put them to 75%. But all of those are building blocks, and this bill takes that away. We have to start at the 60%. Again, issues that we have brought up in the past when similar legislation went through in the prior year that was vetoed by the governor, we were able to point out it might not be the plan that everybody wants, but it might be the plan that that employer can afford to offer. We respect the position of the author and the sponsors on their view on the plans, but we don't think a tool should be taken away from California large employers and their agents to find a way to deal with a problem that they are trying to get through this bill, which is trying to go after what is governed by ERISA. And that is the fact that if you have an ERISA plan and you have employers in multi-states, your plan has to look the same for all of them. So this is changing the rules for that large employer, saying that we have to have something different here that would then affect our plan offerings for those large employers that might be in Connecticut, Nevada, or South Dakota. We think that this is not a reasonable bill. We think this is a large overreach and something that really reduces our ability to provide something to the employer community that meets their needs and also is financially viable for them. We understand their dislike of some of these products, but but they are permitted under the ACA, and I don't think that we should move California out of conformity with that. It is not closing a loophole, it is closing a door. Ask for no vote.
Good afternoon. Sherry McHugh, representing the National Association of Insurance and Financial Advisors. I, too, would very much like to thank the author and the sponsor for working with us. The bill is definitely an improvement over what we saw in print a week and a half ago, and so we thank them very much for taking the amendments. I would just like to echo Ms. Broyles' comments and simply like to add that our agents are by no means opposed to making sure they hit that 60% minimum value. That is what they hope to do, and in fact, most of them, if they're doing their job correctly in their communities, they're trying to sell more than 60% value and trying to get the employer as much coverage as possible at the most affordable price for that employer. So we are just concerned about taking an option away from agents to try to ultimately make coverage more affordable for large employers, and we're very concerned about those California-based employers with out-of-state employees and making California unique and different than the other 49 states in the nation. Thank you.
Mr. Chair, members, John Norwood on behalf of the Independent Insurance Agents and Brokers of California would concur in the previous comments. I think it is an issue for many of our employers that have multi-state plans, and the key in the end is that it's about getting to 60%, not about how you get there. The idea is to give large employers the ability to pick and choose different options that aren't off the shelf and that result in a more affordable plan that they can provide for their employees. For that reason, we're opposed to this bill. Thank you.
Thank you. See no other opposition. Any questions? Yes, Senator Nielsen.
I find it kind of interesting, I guess, would be the choice of words, that in that, what was it, 7,000-page bill, the ACA, that we'll get around to reading someday. Maybe someone has finally finished reading it. I hate to be facetious, but that is not my point. That was a bill born of many long hours of negotiation, and this 60% thing, was that a part of the negotiations? It was.
Yes.
And then my argument would be that's not keeping good faith. That may not have been a law, but for that provision being taken, that compromise being wrought, and now we're coming back and changing it. For what compelling reason? How many people have suffered any irreparable damage by not reaching that level? I don't understand the motive of the bill. I guess that's my point. Or the critical urgency of the bill, may I say. Can someone give me that?
Senator Nielsen, Beth Capel on behalf of Health Access, the sponsors. The federal law, as I have read it, which I have, appears to require that coverage be both affordable and provide at least 60% minimum value. There's a subsequent interpretation by the Internal Revenue Service, which is one of the key agencies implementing this, that an employer who offers coverage that provides less than 60% minimum value, that if the employee accepts it, they are barred from obtaining the tax subsidies through the Covered California R exchange. So the employer avoids the employer responsibility penalty, and by offering this very limited coverage, prevention only, and the employee is then barred from obtaining coverage through Covered California, which would be comprehensive and affordable. It is that has led us to seek to improve on the IRS's interpretation of the law. Many of us who had followed the enactment of the law, indeed attended hearings in Washington, D.C., and have read much of the law, were surprised that the Internal Revenue Service interpreted the law this way. But, laws, as you know very well, sir, better than most of us, laws as they're implemented are interpreted, and sometimes in interpreting complex laws, unexpected things happen. So California has time and again improved on the Affordable Care Act, and this is yet another time we would hope to.
Has there been some case law that hits that point, or has there been litigation to that point yet?
It's not case law, sir. There's a frequently asked questions from the Internal Revenue Service guiding employers in their responsibilities.
Mr. Chairman, could Mr. Norwood respond to
if you wish?
Yeah, if I may, there's nobody at this table objecting to the 60%. I mean, the The issue here, this bill says that you have to start with a plan that hits 60% before you can add building blocks. What we want is the option you have under federal law where you can start with a plan that has less than 60, build the building blocks to get to 60, 70, 80. If you want to do a bill that says nobody can have a plan less than 60%, I think we're all supportive. But this bill's not it.
Any other comments, Senator Nielsen?
No, thank you.
Okay. Senator Roth.
Well, I guess a couple things. So did I hear you, since these are ERISA plans, are you saying that a company in California could not have a different benefit structure for its California employees than it has for its employees in New York and New Jersey?
When you have, if I might, through the chair, if I might answer, you may have a large employer with a health plan that is approved under ERISA, is governed by ERISA rules. If you do offer an ERISA-based plan, you must have that available to all of your employees across the country to meet those same things. I can't have an employer who has a health plan that only provides limited benefits in one state and doesn't provide all of the same benefits in the other if it just meets that 60% minimum value.
No, is that true? If you're an ERISA welfare benefit plan, right?
Correct.
That if you're a California employer and California has a particular rule for employees employed in this state, that you cannot have a bifurcated employee welfare benefit plan under ERISA that provides a different benefit for all of your California employees. You can't discriminate among California employees, but you can't have a plan that provides a different level of benefit in California than you do in New York for your New York-based employees?
Your ERISA-based plan, if that is what you're doing, so the state cannot affect an ERISA-based plan?
No, I understand, but that's a different issue. That's a preemption issue. But you're saying that if you can't have a different set of benefits applied equally across the board to all of your California employees than you do for your employees based in New York?
Oh, I'm sorry, I misunderstood. Yes, you may have a different plan, but it means I have a different administrative process for that plan here than all of my other employee sites throughout the country.
Summary plan, description, all of the other things are different because the plan detail
will be different here.
Slightly different issue, right?
Right, yes, sir.
So, one other question, and this will illustrate that I'm a simple person without much knowledge in this area, but so if I'm employed by an employer with a health plan, may I choose to not take that health plan if it doesn't meet this minimum standard in order to fall into covered California and buy my own insurance?
Yes, but you would not get the subsidy. If it doesn't meet the 9.5%.
So if my employer has a plan that doesn't meet the minimum level for whatever the test is, as an employee, I can refuse to decline to take the plan benefit and throw myself into covered California, but I would not qualify for the subsidy because my employer's plan does not meet the minimum test?
Go ahead, yes.
Let me, I think that's not quite accurate, because if it doesn't meet the minimum, I may be wrong, but let me see if I can explain. If it doesn't meet the minimum 60%, they can decline and they will get the subsidy.
The circumstance this bill addresses is that this is often offered to low-wage employees. I mean, this is a confusing area of law for those of us who spend our lives on it. So imagine that this product is offered to a low-wage employee. We've had some examples already in the articles where people think it's my employer's coverage, I should drop my exchange coverage, and because it's employer coverage, it'll be good coverage. And then they discover that, in fact, it's one of these prevention-only plans. They end up with a hospital bill. The hospital's sitting on a pile of, bad debt because they don't have coverage for hospitalization. They just have coverage for cancer screening and diabetes counseling and those other important prevention benefits, but they don't have doctors, hospitals, basic healthcare services. And so that's, even if, how would you know that your employer's coverage is so sub-minimum that you would be exposed to thousands of dollars of medical debt unless you decline your employer's coverage? Notice does not seem sufficient in this circumstance, hence the need for a minimum standard in California.
But if I knew that and I
Yes.
chose to get something better, I could drop out of the employer's plan, fall into covered California, qualify for the subsidy and buy the bronze or the whatever.
That is correct, sir.
Thank you, Mr. Chair.
If you knew.
Thank you, Mr. Chair.
Thank you. Senator Pan.
So I just wanted to follow up on a statement made by the opposition. You said that you'd have no problem with a 60% standard, but you want to have the building blocks to get there.
Correct.
And I'm hearing from the proponents that actually people are offering plans that clearly are not even 60% no matter. So, can actually, Ms. Capel, can you address the opposition's point that, well, we actually are fine with the 60% standard. We just want to come up with a different way to come up with it.
We have sought technical assistance of the regulators who have queried their licensed health plans and insurers. We are not aware of any of the major health plans or insurers. I mean, Blue Shield and Anthem are in support of the bill. We're not aware of any of the major insurers in California that are currently offering large employers coverage in the fully insured market that is less than 60% minimum value. We actually checked this out because we did explore this potential, but we would literally be lowering the standard from what is currently offered. So we chose not to go down that path. We wanted to instead, for large employers, set as the floor the same 60% value that we have in the small employer market. So that's why we did actually, when they say we considered things seriously, we did. We looked at that and concluded that we would in fact inadvertently be lowering standards from what the current market is, not the current law.
Okay. And then just to follow up for the opposition, have you offered language or proposal about how you would go about ensuring, it sounds like there's agreement on 60% standard. There's a disagreement about how to get there, but has there been an alternative presented to say, well, this is the alternative language that we would propose in order to get to, but still require 60%?
We have had a number of discussions with the author and the sponsor about our concerns about the bill. We have not given them specific language. We have talked with our agents and what they do. They do say that a large employer might, again, one of the examples I was given, they might buy a Kaiser permit says you can go and you can carve out the pharmacy benefit. You can buy that plan today. And then they will self-insure for part of that. They will have a health reimbursement account for part of that. So it's all pieces of getting to that 60% or even over that.
So, but what I'm looking for is, I realize that someone could try to do that, but how do we put into law to say that the employer has to get there versus saying, well, they can, but there's no legal force behind an employer who doesn't.
And part of, if I may, Mr. Chair, through the chair, part of the challenge that we faced is that if part of it's self-insured, we cannot in state law regulate it. And so part of the amendments that are coming out today was an attempt to do that, where we concluded we overreached on something that was preempted.
We will continue to talk.
And we will as well.
I believe Senator Woke is going to be moving the bill. I've got a motion by Senator Woke. Seeing other comments, I've got to make a couple statements. So I believe very strongly in the success of the Affordable Care Act and the minimum standard of the 60%. And I definitely believe that employers should not, or anyone should try to dumb it down, skinny it up, or junk insurance, or whatever. With regard to Senator Roth, an entity or a business could choose not to, but they have to notify Health and Human Services. The employee could not buy it through the health insurance or get offered. They do get the subsidies. I think the disagreement here is not the 60%, but the disagreement is the building blocks to it. So I will state, I did hear the opposition, but I heard it today late in my office. I don't know if that was a scheduling conflict. unfortunately, we don't have any language, so what we're voting on is the bill in chief.
Yes.
So I am supportive of the bill in chief, and unless I had specific language, I can't make that determination at this time. But I do have a question, and I've been asking my staff, and I want to find this out. So I understand that a business, if they're below 60%, have to notify the feds, but is it required that the business notify the employee? That's the question I have. And I don't know if I have that answer, because if that's the case, I have a concern, because they can notify the feds, and if they don't notify the employee thinks they're getting health insurance that meets the minimum requirement. I'm not saying to amend this, but that's a concern I have, because now the consumer is not going to be offered appropriate health care. So it's an open question, so I don't know if anybody can answer that.
Beth?
I'm not, we will check and get back to you, sir.
Because that's a concern that I would have, that, okay, the employer has every right not to meet that minimum. They're going to notify Health and Human Services at the federal level. But if they have, let's say you're the employee and I'm the employer and I tell you, here's my insurance plan, and you buy it all happy because it's well inexpensive, but it doesn't meet the minimum standards, and you go to the hospital, I think the consumer needs to know that information, at least at a minimum. So that's just kind of an outstanding question. Yes.
Thank you, Senator. Sherry McHugh again with the National Association of Insurance and Financial Advisors. What we did discuss with the sponsor is the idea of the agents providing the employers with documentation that they hit at least the 60%. So they had that documentation that then could be shared with their employees, assuring their employees that they had at least a 60% minimum value. So we did have those discussions. We also talked about documenting our files and so forth that agents should be doing anyway. So but that was something we talked about.
That's good policy, because you're notifying the consumer, but I'm just trying to figure out, just an open question. So, but I am supportive of the measure as it's written. We do have a motion. Some member, would you like to close?
Thank you, Mr. Chair. As you can see, there is a lot of common ground between the support and the opposition groups. Because of the late noticing on some of the concerns, we are happy to look at, review, and have a dialogue around any additional proposals to make the bill better. And so with that, I respectfully ask for your aye vote.
Well, I appreciate that. Unfortunately, there's not a lot of room left. We're at the last house. Only committee left is appropriations. If you want to address that there, go for it. So that might be the place, but after that, there's not much room for error. So anyway, with that, we have item number 5, AB 248, I'm sorry. Do pass as amended appropriations, moved by Senator Wolk. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Hall. Mitchell. Mitchell, aye. Monning. Monning, aye. Nielsen. Nielsen, no. Pan. Pan, aye. Roth. Roth, aye. Wolk. Wolk, aye.
Okay, we're now at item, let's see, hold on. That has 6, enough to get out. We're going to place that bill in call.